is yours.
Okay, well, I'm glad to be here. S.tyler, I'm an audiologist and also a trained as a psychoactive physician. I've been doing research and running a clinic at the University of Iowa, otolaryngology department, patient sciences and disorders for many years. So this is an introductory lecture about the hearing and tinnitus. So of course we have sound waves, move the eardrum back and forth. Behind the eardrum is what we call a middle ear air-filled cavity with little bones that move back and forth. And then there's a cochlea where the nerves are that connects to nerves up to the brain. So here is the hair cells in the cochlea, and there's nervous impulses, electrical activity, little pulses that send information up to the brain that lets the brain know that there's some sound out there. So even when there's no sound, there is activity on those nerve fibers. But normally the brain doesn't interpret it as sound. There's no sound, there's some spontaneous activity, however. When somebody says a word like table, and any of those nerve fibers are activated, and the brain interprets that neural activity as the word table. Or if there's a cricket outside, and the person's auditory system responds in a different way, different nerve pulses, and the brain hears that as a cricket. So there are many different causes of hearing loss. The most common one is aging. So all of us are going to get a hearing loss eventually. It's part of the natural aging process. Noise is the other most common one. People who work in factories, people who fire guns, people who have noisy hobbies. There are lots of medications that can cause hearing loss, and many different disease processes that also cause hearing loss. So in that normal ear with all those activities, there's spontaneous activity. When there's a hearing loss, you actually lose some nerve fibers. So there's not as much activity on the nerves, there's not as many nerves to send information up to the brain. Unfortunately, at this point, there is no cure for sensory neural hearing loss. We cannot replace hair cells, although people have been trying that for years. But there are hearing aids that can help all of us hear better. Make it easier to understand, easier to interact with people. They do not make your hearing normal. They amplify sounds as a function of frequency and can be very, very helpful, but they do not restore hearing to normal. So we should all get our hearing tested. It's the audiogram, where it's the level of a pure tone, the quietest level that you can hear that. And 0 dBHL is the average of 19-year-olds at a state fair many, many years ago. So if you have a hearing loss, a pure tone threshold, hearing loss of 30 or 40 dB, you're not going to be able to hear some of the high frequency sounds. Some people that actually have 0 dB thresholds, actually when they were 19 years old, they might have had thresholds of minus 20 dBHL. So their thresholds now of 0 or 5 dBHL means that they're missing hair cells, and they're going to have some difficulty understanding speech. So tinnitus. Anybody here have tinnitus? Probably a lot of you. It's very common. You'd be surprised. So I categorize tinnitus the same way that I categorize hearing loss. You have a middle ear tinnitus, and you have a sensory neural tinnitus. So in the middle ear tinnitus, it's less common. It's very, very rare, but it could be related to blood flow. Glomus tumors, there's abnormalities in the health system about how the blood flows throughout your body, but also in your middle ear. But it also could be muscle related. So there's muscles behind your eardrum, and sometimes those muscles twitch. Or there's a eustachian tube that goes from the back of your middle ear back to your throat to keep the air pressure behind your eardrum equal on both sides. So this is the muscle that attaches to the eardrum. This is the eardrum looking inside, and the bones behind the eardrum. And if that muscle twitches, sometimes by eyebrow twitches, but if your eardrum is twitching, then you can hear that. This is the inner ear again, and this is the blood vessel, the carotid artery. And so if that blood vessel is pulsing, then some people can actually hear the blood vessel pulsing if the skin is thin in that area. These are both very rare. This is middle ear tinnitus, it's very rare. The most common form of tinnitus is sensory neural tinnitus, involving the spontaneous activity, as I mentioned, that goes on. So just very briefly, we have all these nerve fibers that goes from our ears to our brain, and in fact nerve fibers going all throughout our body, and they connect with these synapses, and there's electrical impulses that are passed one at a time at these synapses, and that involves different chemicals going through. So this is a synapse, the chemical is released, the neurotransmitter, and picked up here, and it's like a little spike of activity, a little spike of electrical activity. So there's spontaneous neural activity that goes on all the time. It's very low, but normally, because the spontaneous activity is infrequent, we don't hear it. But if the spontaneous activity is increased for some reason, then some of us are going to hear that neural activity as tinnitus. It might be due to some increase in excitatory chemicals at those nerve fibers, or it might be a decrease in inhibitory chemicals as well. This is only one theory, there are many. So about a third of the people hear tinnitus in one ear, over half, most common, hear it in both ears. Occasionally somebody hears it in their head, not very often. So there are lots of different models of tinnitus, lots of different theories on what is causing it. And this is part of the reason why it's complicated and no cure has been found yet. An increase in spontaneous activity that I talked about already. The nerve fibers might be active at the same time, so the brain can interpret the activity on nerve fibers that are side by side, and that might mean there's some sound going on there. Or there might be more nerve fibers with the same best frequency, the frequencies they respond to fall into hearing action. Now that's the perception. The reaction to the tinnitus involves all different parts of your brain. So I'll talk about this, the tinnitus and the reaction to the tinnitus. Those are two separate things. The reactions involve the amygdala, the autonomic nervous system, and many different parts of the system. So I've talked about the hearing nerve having spontaneous activity even when there's no sound. When you say the word table, many of those nerve fibers are active in a certain way. But for tinnitus, there's some electrical activity on those nerve fibers, even though nobody is saying anything. So it's the activity without any sound on the side. So one of the theories is what's referred to as cross-fiber correlation. So the spontaneous activity on nerve fibers is usually independent, uncorrelated on different nerve fibers. But it may be because of the disease process that the nerve fibers are going at the same time as spontaneous activity. And the brain might say, oh, look, there's something happening up there. Another reason why this might happen is because of the nerve fibers have myelin sheaths around them. The electrical activity is going down these myelin sheaths. But if there's a problem with a myelin sheath, the electrical impulse coming down here might be picked up by adjacent nerve fibers. So that's one theory. And that's another one is reorganizing after hair cells are destroyed. So when you lose your hair cells, as we're all doing from the normal aging process, there's going to be some silent regions in the brain. And the brain still has nerve fibers, and the brain might sort of change how it functions and look for other activities. And that might mean this overrepresentation of some nerve fibers. The brain has to be involved. It could be the source, but it certainly is involved in the reactions to the tinnitus and your emotions that you have. And it's different from different people because we're all different. We all have different emotions. We all have different things in life we have to deal with. Many different causes of tinnitus: noise, head injuries, medications, the aging process. A lot of it is unknown. A lot of the causes are simply unknown. So, as I said, it's very common. About 15% of the population, maybe even more than that, have tinnitus. And some people have it very problematic. Over the age of 60, it goes up really, really high and can be very serious in some people. I said about 50% of the people hear it in both ears. There is no cure. There's no treatment for tinnitus at this time. There are no studies. There's been lots of research trying to find the causes and trying to change nerve fibers and trying to change the brain. But at this point, there is no cure for the tinnitus. There are medications for anxiety and depression and things to help us sleep as well, and those are okay. They're not helping with the tinnitus, they're helping with the reactions to the tinnitus. So this is my psychological model of tinnitus that I proposed many years ago. This is really important in understanding tinnitus and understanding the treatment of tinnitus. So the tinnitus has some characteristics: pitch and loudness, where you hear it, and it also can annoy you. So you have your tinnitus and you're annoyed by it. But the way you're annoyed by it depends on you as a person. So some people have a wonderful life, there's lots of good things, nothing to worry about, lots of support. Other people have challenges at home, have challenges at job, and now when you get tinnitus, oh no, this is one more thing I have to deal with. So you have to appreciate the tinnitus and the annoyance or reactions to the tinnitus. Those are two separate things we have to measure separately. There's no cure, no drug, and there are counseling sessions and sound therapy sessions that we'll talk about later that can actually help you cope with your reactions to the tinnitus. And you can change your reactions to it. So I've developed a counseling strategy that's been used worldwide, referred to as tinnitus activities treatment. And I'm just going to show you an example of what some of those slides are to give you an idea of what the tinnitus activities treatment is. So I asked the patient, where do you want to start? I want to connect with them. What do you think caused your tinnitus? So I want to hear from them. I want to connect with them. When your tinnitus began, what was your life like? How has it changed your life? And importantly, how do you think I might be able to help you? I want to help you, but I don't have a magic pill either. So I want to know what your expectations are and what you've already tried. That's important for me to understand the individual patient. So our treatment focuses on 4 different areas that can be affected by tinnitus: thoughts and emotions, hearing, sleep, and concentration. Different in different people. Not everybody is affected by concentration. Not everybody is affected by sleep, but many are. So I'm just going to show you a few slides from each of the different sections that we provide counseling. Thoughts and emotions, we talk about hearing, tinnitus, reactions, and they have practice activities they have to go home with for 2 or 3 weeks. We talk about paying attention and how things can capture our attention. So, for example, lots of things, taste, touch, smell, vision, all these things can capture our attention. If something is really important and we focus on one thing, then the other things go down in the background. But if there's something that captures our attention, like if a police car drives by the siren, we all listen to that siren. It captures our attention. So we can decide to pay attention to things. If the siren goes past and there's nothing wrong here with us, we can make a conscious decision. Okay, it's just a siren. It's gone. It's not affecting me. It's the same sound. So they then go home with homework. We can ask them to describe an image, describe a sound, and to make some comments about what their tinnitus is like. We can also look at their understanding of the emotional reactions. So our thoughts and emotions can neutral, negative, or they can be positive. So the example here is the doorbell goes off. Just the doorbell. The doorbell goes off, and there's a fire next door. 2 weeks go by, the doorbell goes off, and there's a car accident outside your house. 2 weeks go by, the doorbell goes off, and a tree has fallen on the neighbor's lawn. It's all the same sound. A month goes by, the doorbell rings, someone sent you flowers. The next day, the doorbell rings, and it's a friend. The next day, the doorbell rings, someone sent you a gift. It's all the same sound, but your intention and interactions with this have an effect on your reactions to it. So what thoughts have you had about your tinnitus? What situations has it been bothersome? What do you feel about it? Tell me about how your interaction with your tinnitus. Well, it's certainly true that the spontaneous activity is increased. Many people, you probably have friends that have tinnitus, you just don't know it. And we might not be able to change your tinnitus, we might not be able to make it go away, but we can help you change your reactions to it. So let's talk about different hobbies you have, and what things you can ignore, and what things you focus on. So we have them practice some of these things with background sound and with visual imagery and the counseling strategies. We also talk about sound therapy. So you have this activity on your nerve fibers that you're hearing as background sound. When you play a low level of noise that has different activity on the sound, when you play the noise and you have your tinnitus, that activity of your tinnitus is no longer prominent. So your brain's not hearing that tinnitus the way it did without background sound. So an example of this is you have a candle in a dark room. It's very prominent, it's very bright. You have the same candle in a window where it's light, and the tinnitus prominence is going to go down with background sound. So you have a dog, you don't like dogs, bothers you. Play some sound, keep yourself busy, and eventually both the sound and the dog and maybe your tinnitus drifts away into the background. So we'd like to know what sounds have been helpful for people and have they listened to different background sounds, and have some examples that the smartphone you can listen to. So for example, they're going to listen to rain, music, waterfalls, static noise. People often have found on their own different background sounds that make their tinnitus less prominent. So the activities they're going to do with this part is practice their attention, thinking about something else, thinking about different activities they can enjoy, and try to use some different low-level sounds and see what helps them. With the hearing and communication session, we're going to talk about the things that make communication difficult. And again, we're all losing our hearing. So we also measure their hearing, make sure they have an audiogram in front of them, and that can be done on the smartphone these days. So this is an example of somebody who has normal pure tone thresholds. This is somebody who has what we call a noise-induced notch. So their hearing is worse at 4,000 hertz than it is at 2,080 hertz. This person might have been working in a noisy factory for 10 years. This person might have been working in a noisy factory for 3 years, and they have the beginning of a noise-induced notch. They won't notice it. Again, we're all going to get a hearing loss eventually, part of the natural aging process. So the hearing loss can again be conducted behind your eardrum. Usually it involves the sensory neural system. So this is the different sounds that are evident, with most of the energy of high frequency sounds like the F, the S, and the TH at the end of words are ones we're going to miss early on in the beginning of our hearing difficulties. So we can actually make some changes in the background noise to help us, and that might mean that you have to be in charge as the individual with tinnitus and hearing loss to move the conversation away from the noise, or to turn the noise down. It's also important to see the speaker's face and to make sure that they're speaking clearly. that's very helpful for lip reading. So what's your situation with your hearing? What kind of difficulties do you have hearing, and what do you not have difficulties with? What have you tried that's been helpful? How has tinnitus affected your hearing? Well, tinnitus is not damaging your hearing per se, but the tinnitus can mask some of the speech sounds. And so what kind of strategies have you used? Amplification, reducing background noise, making sure you're watching faces, using some of the repair strategies. There's lots of effective communication strategies that you can use and you can practice on your own. There are benefits of hearing aids, clearly. Hearing is really important. It's not about hearing per se, it's about interacting with people, socializing, enjoying life, having friends, working. So hearing aids are really, really important. And some of the things about this hearing is asking people to slow down. This is the interactive stuff. So can you speak slowly for me? I want to make sure I can see your face. The sleep session. Sleep is a very common problem for tinnitus. Lots of things can affect our sleep, our activity during the day, medications, caffeine, alcohol. So preparing for sleep, we can use background sound to mask part of our tinnitus, to make things cool and calm in the room. I actually had a person come out to my tinnitus conference that I run every year in Iowa, and this person thought that all of his colleagues would want to rock and roll all night long at the university he attended. So he actually put a speaker inside of a pillow. It turns out all of his college students did not want to rock and roll all night long, but his father had tinnitus. So he actually used and developed a company called the Speech Pillow. It has sound in the pillow. There's also different exercises you can use. Progressive muscle relaxation to take your mind off of the tinnitus and focus on squeezing your muscle and relaxing. Visual imagery, closing your eyes and imagining you're on a beach in Bermuda. The concentration sessions go with using background noise to show that you can be distracted when there's something noisy going on. You could also be distracted by lighting, people walking by. If you interpret the tinnitus as just a sound in the background, it's not important, that's going to make it easier for you to think about other things and concentrate on other activities in your life. Staying focused is really important. And so we have practicing with people in their concentration sessions to be able to do things and ask questions and be in charge and connect with people, not just sitting back worrying about your tinnitus. Sound therapy can be very effective in this as well. So lots of different ways of having sound therapy. And of course, these days, using our smartphone to connect with earbuds also can be helpful to make sure that tinnitus is not so uncommon. A visual attention example is focusing on one object, focusing on the pen. Okay, now focus on the window. Now focus on the book. And when you're focusing on these things, you're not focused on your tinnitus. So, sound therapy can be really, really helpful for tinnitus. You can pay attention to the sound in the room. There's background sound here. You can actually listen to your tinnitus. Focus on your tinnitus right now. Now focus on the background sound in the room. So you can be in control of your attention and focus on one thing versus the other. So that's an important part of sound therapy that we'll talk more about in the next session. So tinnitus is common, 20 to 30% of the population at large. So a lot of people have tinnitus here. It's usually accompanied by hearing loss. So we're all getting a hearing loss, and it's quite common to have hearing loss and tinnitus. At present, there is no cure for tinnitus. There's no pill that you can take that's going to make your tinnitus go away. It's different in different people, but it can affect your thoughts and emotions, your hearing, your sleep, or your concentration. different in different people. So you have tinnitus and the reactions to the tinnitus. So those are two separate things. There are several counseling procedures available to help people with tinnitus. The one we've developed is tinnitus activities treatment that focuses on those 4 different ways: thoughts and emotions, hearing, sleep, and concentration, depending upon your own individual needs. And fortunately, there are lots of very clever hearing aids these days that help you hear better, and sometimes the hearing aids can actually help amplify some background sound that can be good for people with tinnitus. And many of the hearing aids these days actually have sound therapy built into them. So you can actually, from your smartphone, you can turn on waterfall music or raindrops or some other background music that takes the prominence away from the tinnitus and makes it easier to move forward. So, thank you very much. That's the end of my presentation. Do we take questions or not?
So how does your product with this company help? Because this is, I mean, you said there was no cure.
Right.
I knew that there was no cure. So I'm wondering how does this help?
Right. So the question was, well, there's no cure, so what help is there? So if you can, we're all going to get a hearing aid, mostly a hearing loss, mostly, and the tinnitus can interfere with your hearing as well. So having the hearing aids is going to amplify background sound to hear over top of the tinnitus, and sometimes the background noise in the room, controlled properly by your hearing aid, can actually make the tinnitus less prominent. In addition to that, the hearing aid can also have sound built into it. So it's not just amplifying sound in a sophisticated, clever way based on your individual hearing loss, but the hearing aid can also have some background sound built into it, like waterfalls or raindrops, and you can change the level of that background sound going up to your ears. Sometimes you can change the frequency content of the spectrum and make it in the background so that it's easy to ignore. You can turn the background sound off if you want to just hear it clearly. So there's lots of different ways that these hearing aids have changed in the last 10 years. The whole hearing aid industry has changed to make themselves more acceptable and more helpful to tinnitus patients.
When you take them out of your ears,
You take them out of your ears and your tinnitus is still there.
you're still going to be the same.
Right. Well, there's no cure for the tinnitus. So the question is, you're still going to have your tinnitus. So I say to the patient, what can you do to change your life to accommodate to the tinnitus? And what can we do to help? So connecting with a good therapist and having good devices and going through a proper counseling session can be very, very helpful. And for a lot of people over time, the tinnitus becomes less important.
But this product is supposed to be a 4-hour-a-day therapy.
Yeah, you'll have to talk to them specifically about that.
Okay.
Asking cancer. You're not sending an opposite
That's correct.
frequency to cancer.
So that's true. So the
It's not like you're picking up sound waves and creating
yeah. So the comment was that the sound therapy is not like noise counseling. So there are some headphones and some strategies where you can put in a waveform of opposite polarity and equal intensity and cancel a waveform. That's not how the sound therapy works. However, for people who use the sound therapy, you can actually cover up the tinnitus completely. So instead of hearing some piercing whistling sound, you're hearing some waterfall, and that's easier to cope with. It's also true that sometimes listening to the waterfall or some other sound therapy for an hour or 2 hours, when you turn that sound off, your tinnitus can be gone for an hour or for 2 hours. It's different in different people.
change it with the brain in terms of
It changes the neural activity in your brain, and it can change the activity usually on a temporary basis, but it can also give you some control. And so sometimes the tinnitus can be less intense when you're listening to the noise, or sometimes you don't hear it at all. Other questions?
I would like to thank Dr. S.tyler for this experience and this information about the tinnitus care. I would like to give him a round of applause. And then I would like to invite everyone back at around 3:30 for another seminar about the clinical trial and monitoring evidence of quality effectiveness with a doctor from South Korea, and you can ask more questions about the product at that time as well.